Hi, my name is Carrie, and I'm the student nurse practitioner today that's going to be talking about special population with mental health in pediatric and adolescents. So, 1 in 6 U.S. children aged 2 to 8 years old have a diagnosed mental health, mental, behavioral, or developmental disorder. And a study among children aged 3 to 17 years old estimates for diagnosis from 2016 to 2019 anxiety had 5.8 million diagnosed, and then in ADHD group 6 million diagnosed, and in depression 2.7 million diagnosed. Common mental health disorders include depression, substance abuse, and suicide. Here are a list of statistics among the adolescents. Suicide is the second highest cause of mortality among children aged 10 to 14, and there's also concern surrounding the impact of the pandemic on the children's mental health. Children's mental health include expenses for emergency room visits, inpatient hospitalizations, outpatient therapy, and psychiatric medications. Also, in special education services such as IEPs, and an additional cost to school districts for additional staff, training, or therapeutic interventions. Also, the juvenile justice systems, including legal proceedings, detention facilities, probation, and rehabilitation programs. And then there's also lost productivity for impaired academic performance, decreased school attendance, hindered future employment opportunities, and then also parents may experience missed work days and reduced job performance. Cross illnesses, with males more likely to have ADHD, while females were more likely to have anxiety and depression. In addition to the negative effects that mental illness can have on children's quality of life and social development, the additional healthcare costs spent on by these youngsters place a significant strain on the healthcare system. Anxiety screening tools can include the primary screening tool, which is the screen for child anxiety related emotional disorders. And then also the gold standard is ADIS, which stands for Anxiety Disorders Interview Schedule, that diagnoses anxiety disorders validated for children ages 7 to 17. Let's talk about assessment and screening for ADHD. So ADHD is a childhood disorder at ages greater than or equal to 4 years old, characterized by hyperactivity, impulsivity, and or inattention. And the child's symptoms can impair cognitive, academic, behavioral, emotional, and social functioning. You want to get a history to get aspects of the medical history, which can include prenatal exposures such as tobacco and drugs and alcohol, perinatal complications or infections. You also want to get a family history because similar behaviors is important because ADHD has a strong genetic component. You also want to get the sleep history, dietary history, environmental exposures such as lead and tobacco, family stress, and then ACEs, which is adverse childhood experiences. You want to get an educational evaluation and ancillary evaluation, which includes speech and language and occupational therapy, and then psychological testing. Next is the criteria for the diagnosis of ADHD. For children less than 17 years old, requires greater than or equal to 6 symptoms of hyperactivity and impulsivity, or greater or equal to 6 symptoms of inattention. For ages greater than 17 years old, you need to have greater than or equal to 5 symptoms of both. Depression, and talk about the assessment and screening. So, depression in children is a mood disorder and it leads to feelings of sadness that interfere with their relationships and activities. And you want to get a psychiatric and general medical history, mental status, and physical exam with the patient and parents present. The most common tool that you want to use for depression is the PHQ-9, which is a patient health questionnaire that has 9 items. And it's a tool for screening, diagnosing, observing, and determining the severity of depression. Treatment plans, and we're going to start with anxiety. So first, for mild to moderate anxiety, you want to start with cognitive behavioral therapy as the initial therapy. If you don't get a response or improvement to that, just go ahead and add an SRI to that, such as fluoxetine, paroxetine, or sertraline. If you're dealing with moderate to severe, you want to go ahead and start right away with cognitive behavioral therapy and an SRI. If symptoms aren't resolved, then you want to go ahead and switch to a different SRI. And if that doesn't resolve it, then go ahead and switch completely to an SNRI only. Next, we're going to talk about if the patient has a disabling anxiety. You can go to long-acting benzodiazepines that can be useful in children to treat the disabling anxiety, but typically you want to do that while they're waiting for an antidepressant to take effect, or also to treat SSRI jitterness. And then next, if you're thinking about discontinuing antidepressant in a child, you want to make sure that you taper the dose of antidepressants by at least 25 to 50% weekly when stopping them to avoid any kind of harsh symptoms. Still with anxiety, and talk about side effects and adverse effects to teach the patient and the parents. And let the family know that the patient can experience suicidal ideation, so look out for that. They could expect some weight gain, some elevated cholesterol, and also some hypertension. Plan for attention deficit hyperactivity disorder. So in the preschool children ages 4 to 5, the initial therapy you want to start with PTBM, which is parent training and behavior management. And if medication is still needed, we recommend methylphenidate rather than any kind of amphetamines or non-stimulant medications. The next group is school-age children. And we want to go ahead, and that's ages 5 to 18, and the initial treatment is with stimulants combined with a PTBM. A non-stimulant might be more appropriate than stimulants, and to keep that in consideration. And then those who do not meet ADHD criteria recommend behavioral interventions. For children with for ADHD, treatment should be monitored regularly for adherence to the treatment plan. To make sure that we educate the family and patient of any side or adverse effects with ADHD medications. And those would include decreased appetite, poor growth, insomnia, psychosis, and suicidality and dizziness. You want to educate the family on ADHD medications is make sure that they're avoiding alcohol, tobacco, marijuana, and any other illicit substances. May interact with stimulants and exacerbate the attentional problems. So keeping the medication, and then also the big thing is you want to make sure you keep the medication in a safe location, because there's been problems where they like to take them to school or sell them, and those can be a problem. Is depression treatment. So psychotherapy alone is a reasonable treatment for mild depressive disorders. For acute, moderate to severe depression, pharmacotherapy plus psychotherapy as the initial treatment rather than pharmacotherapy alone or psychotherapy alone. And SRI plus cognitive behavioral therapy is the choice of treatment. If the initial SRI medication fails, switching to a different one is the recommended option. Once the treatment is successful, 6 to 12 months of therapy is suggested. And an adverse effects with antidepressants include suicidal thoughts or behaviors. Thank you for your time to allow me to educate on mental health and special populations in the pediatric and adolescent group. If you have any questions, you can reach me in the email below. Thanks and have a great day.